Welcome back, little nerds. It's Saturday morning. We are fully caffeinated and ready to go, so get your pens and papers out. It is Pillow Talk Derm time. I'm Dr. Shereene Idriss, a board-certified dermatologist. And a few months ago, I shared a video on cosmetic treatments that I would not recommend. And today I decided, let us flip the script and talk about the products that I do, or procedures rather, that I do recommend. So today we're going to focus on the quiet achievers in the group that deliver long-term results. They may not necessarily blow your mind today. You may not walk out feeling like a fetus in that moment, but the results do compound over time, and subtle today can be very powerful later. But before we go any further, I want to be very clear in saying that the same way there's no miracle skincare ingredient, there is no miracle silver bullet skincare cosmetic procedure. Not even facelifts are miracle procedures, and each one has its place on its own, and none is a holy grail. But together, using a thoughtful combination over time, you can have beautiful, seamless results. And before we dive into the actual treatments themselves, I want you guys to remember one thing. Your skincare routine is 70% of the work, just like your diet is. You can go to the gym all you want, but if your diet is crap, you're never gonna get there. The same applies to your skin. No matter how many lasers, surgeries, procedures you do, if you're not taking care of it, it's useless. Treatments should be seen like the extra 30%, like the workouts, and when you combine both, that's where the long-term magic really starts to show up. So starting from the top down, I'm gonna start with hair, because August is Hair Loss Awareness Month, and it is extremely emotional to lose your hair. I have experienced dramatic moments where I've lost clumps of hair, especially after my babies, and that's when I became a fan of PRP, platelet-rich plasma, for years. But I never did it in isolation, because when you're attacking hair, it is systemic. It's a 360 approach. You want to throw the kitchen sink, from prescriptions to topicals to supplements, and Nutrafol Vegan was the supplement that I picked. So thank you, Nutrafol Vegan, for sponsoring this portion of the video. After my first baby, I had lost a lot of hair, like handfuls of hair. And I would do PRP to help regrow my hair. But I quickly realized that PRP is like fertilizer. It helps your scalp, but if your scalp is malnourished, it won't really help that much. So that's where the Nutrafol Vegan came into play, because it helped me maintain the strength of my hair as well as my results. The vegan is important because it's biotin free, and that was important for me because if you have an excess of biotin, you can skew your own blood test results. And I do love that it has curcumin as well as tocotrienol extract, both of which have been shown to support hair density and scalp health by reducing both inflammation and oxidative stress. And also the pills are small, so they're very easy to swallow, unlike the big ones. And so that is a huge plus for me. Right now, you can save over $100 if you use the link below, worth checking out if you are on a hair loss journey. Now, PRP versus PRF. What exactly is the difference? Let's get into it, because a lot of people are confused and they are different tools. PRP is drawn from your own blood. We take your blood, we spin it at a very high speed, and it contains concentrated platelets in a liquid plasma base. It is rich in growth factors and it acts very quickly, making it ideal for scalp treatments where you kind of want faster results, especially when you're looking for a regenerative push. PRF, or platelet-rich fibrin, is your blood as well that is spun at a lower and slower speed with no anticoagulants. So this allows a fibrin clot or gel matrix to form, allowing this matrix to hold your platelets, white blood cells, and even stem cells, and it releases growth factors slowly over several days. The gel-like consistency is an added bonus because it helps with volumizing effects, especially for the under eyes, upper lip area, etc., wherever you're losing tissue and wherever you're trying to build back collagen density. So it doesn't just stimulate hair follicles, it also builds collagen density. That volume rebuilding is shorter lived and not long term, but it's a nice added benefit. So my experience with both PRP and PRF, I will tell you this, I have injected PRP into my scalp several times and it's still my go-to for managing shedding and boosting regrowth. For my face and for collagen density, I've done both PRP and PRF. And in my experience, I like the PRF more because it gives more of that volumizing and gradual effect, while PRP is a little bit more inflammatory. So I like the slow and steady with the PRF. I've even done PRF in my upper lip. Never had filler in my lips, and it is just PRF to help with the density of my lips. And it truly has made a difference. And I've done that just once in January, and it's currently July of 2025. So these are not quick fix results. They're very subtle. They happen slowly over time. They help with elasticity support and collagen production, and the results show up longer term. It's kind of like losing weight. You don't see it right away. You notice it more in hindsight, and it's not permanent. It should be maintained. as should these results. And therefore, there's no one time fits all. Now, when it comes to your skin, I love microneedling now. I used to hate it. I thought it was useless. I will be honest, but I have reevaluated, and everything that I do not like, I go back to try to be honest with myself to see if my opinion changes. And my opinion has changed with microneedling, but there's a little asterisk with this. I like microneedling for people who cannot tolerate anything that has too much inflammation. And why do I like it? It's because you use tiny little needles, and I'm not talking about your at-home devices, to create controlled micro injuries on your face, triggering your own natural response to healing for collagen production and elastin. I like the fact that it's non-thermal, so there's no radio frequency, it doesn't involve heat, and that is key and essential, especially if you have melasma, where when you put heat and you disrupt your skin barrier, you can worsen your pigmentation long term. But the asterisk with microneedling, where it makes the biggest difference is when you combine it with a booster, a topical adjunct of some sort. When you use something topically, in addition to microneedling, when your skin is open now, more permeable, with tiny little doors open all across your skin can really absorb that product better and allows you to deliver better results and maintain those results better over time. I absolutely love combining microneedling with PRP. Even PRF to a certain extent. Topical PRP, though, is thinner and easier to get through, so it enhances wound healing, it supports collagen remodeling, and it even reduces the downtime of the procedure itself. It's regenerative and it is safe for all skin types. I also like it with Rejuran, aka polynucleotides, aka salmon sperm, aka salmon DNA, to help to reduce inflammation, improve the hydration quality of your skin, and support dermal remodeling. But it's very important to note that Rejuran is not FDA approved for injections in the US, and anybody who is injecting it is doing it illegally and risks losing their own professional license. So I only apply it topically after microneedling. It is both safe and legal, and it can still deliver benefits. Now, there is going to be a special focus with microneedling and melasma because that's where I fall in, and I think a lot of you guys do too. Microneedling is actually a very strategic tool if you have melasma, but you have to be very, very careful. It can worsen if the inflammation and heat are not controlled, especially at the time of year. I also like to skip microneedling with radio frequency because that can make melasma patients flare up. So instead, I use basic microneedling, and I use it with a carefully curated selection of topical treatments or even injectables. And this is where we talk about tranexamic acid as an adjunct to microneedling. Topical tranexamic acid, the stuff that you find over the counter or in office as an adjunct to microneedling, helps to calm melanocyte overactivity. It's actually a prescription that can be prescribed. It reduces visible pigmentation gradually. It works well when applied immediately after microneedling when the doors are open for enhanced penetration. And the reason why I like it is because you see a result much better and much faster. But if you inject that topical tranexamic acid, not over the counter, I'm talking about medical prescription level, this is where it gets next level. When you inject it directly into the dermis, it allows for a deeper action, especially helpful if you have very stubborn dermal type melasma. It helps to target that vascular inflammation. It reduces that pigment production directly, and it is much more effective than topical application alone, especially in those cases that are very resistant. So I often use it as a technique when I do fine microneedling. I do these injections all across the skin, and I combine it with the microneedling to really disperse the medication underneath the skin, and it works beautifully, especially injected. It is next level and hands down probably one of my favorite treatments in office today. Sometimes for people with resistant pigment as well, I will layer in glutathione, which is an antioxidant for extra support, and it makes a nice difference and it gives a beautiful direct glow to the skin. The downtime and the protocol. So what should you expect if you're going to get microneedling treatments? Anywhere from like 1 day of redness to maybe 3 days. Avoid the heat. Don't power wash your backyard if you're going to do it. It's just not worth it. That was a mistake. Do as I say, not as I did. And normally I'd say start with one treatment, see how you feel, space them out every 4 to 6 weeks, and then try to get those treatments in. When do you see results? You will feel like you see a glow almost immediately, but the real changes, the texture, the color, the collagen production takes around 4 to 8 weeks to really start to kick in, and they keep building afterwards. So when it comes to microneedling, it's not a flashy treatment. I'm not talking about at-home microneedling where you can get a lot of trauma on your skin, but I'm talking about very thoughtfully done microneedling in office paired with either PRP, prescription tranexamic acid, even glutathione, or polynucleotides in the form of Rejuran, not the over-the-counter form. And if you're struggling with melasma, it's one of the, I would say, safest procedures to do and tools we have in the office, because I do not believe in any sort of laser device if you have melasma that has not been treated or is not able to get under control. Now, the last treatment, we talked about hair, we talked about skin quality, is the skin elasticity overall and tightening. This is one of my favorite tightening tools, Ulthera. It uses micro-focused ultrasound energy to create tiny zones of injury deep in your SMAS, the same layer that is lifted during a facelift, so that can stimulate collagen production and elastin and tighten over time. It is one of the only procedures that is FDA cleared for a brow, chin, neck, and chest lift. There's no incisions, there's really no downtime, and the results take 3 to 6 months to kick in. It is like a very slow weight loss program, but it does help to tighten your skin. Is it going to completely give you a facelift? No, but this is where you have to have realistic expectations. And it hurts. It absolutely hurts. It is not a painless treatment, so you want good pain control. We give laughing gas, we give Valium, and it also is very dependent on the provider and their skill set. Because some people, if they're not moving correctly, what does heat do? It could melt fat technically, but knock on wood, over the 10 years that I have been doing it, is not something that I have seen. I have only seen, honestly, very effective results. Now, some people will compare it to a platysmoplasty, which is not a facelift or a neck lift. It's when you tighten the muscles of the neck. I don't think it's similar to that. I'm still open to one day getting a platysmoplasty to pick that up. It's almost like when you have a diastasis postpartum and you want to close your abdominal muscle. You can close your platysmal muscle to get a little bit tighter because you don't have necessarily lax skin, but it helps with the laxity in your skin, especially if you're someone who never wants to go under the knife. Now, I don't do all of these things all the time, and you guys see me on stories, and I am not every single day doing something on my face at all. It's really like I've done filler once in 2024, but you do have to understand that this is a little bit of everything. And if you want to approach it and you want to ask yourself, how do I approach it? For me, what I tell patients is twice a year you have maintenance visits, whether that is your Botox and filler appointments. And then every year you figure out, what is your project? Is your project PRP or PRF for your under eyes or your hair? Is your project a tightening treatment like Ulthera? Or is your project trying to figure out how to deal with your melasma or how to deal with superficial texture with microneedling? Once you figure that out, then it's much easier to figure out what you want to get into your routine for that year and what you want to incorporate into your treatment plan. And then every day I'm on my skincare routine with that sunscreen, and I'm trying to sleep better as well, because that is absolutely correlated to how your skin looks, especially when you hit your 40s. If you guys want to hear more about how I plan cosmetic treatments across the year for patients, or you want to understand a bigger lay of the land, let me know below in the comments, and I'm absolutely happy to do a video on it. But until then, wear the damn sunscreen, approach these procedures with a positive attitude, and the reality is, they are tiny little tweaks that you do over time. And if you are consistent with those small tweaks versus trying to be super intense, because at the end of the day, it's consistency over intensity when it comes to all of this stuff, you will age more seamlessly over time. So with that, have a beautiful Saturday, and I will catch you guys next week.